We're back with Max Botticelli, President and CEO of University Health Alliance.
What would you do different in your private practice now that you've been running UHA for so long?
I think I would have looked towards systematizing patient care a little bit better. The difficulties, the issues that involve the quality of care right now aren't involved in not having the capability of taking care of an individual patient. It's making sure that all patients get a certain level of care. For instance, immunizations, and making sure that they're done on a schedule. That takes some systematic approach to health care, making sure that patients who have certain illnesses get certain medications. For instance, diabetics. There are certain medications that diabetics should be taking because of their diabetes, and in making sure that they get those medications. So it's more of a systematic approach than an individual approach.
It seems like you are very involved in the care of patients, whether they're coming to you as a physician or not, providing them the best health care. But do you miss the one-on-one contact with these people?
Yes, yeah. That was the real reward for practicing medicine for 25 years. Yeah.
And when you were practicing, especially more when you started, did you ever think that you would evolve into starting, your own much larger business?
I think what happened was a gradual evolution where the pressures of treating individual patients on an everyday basis got to be greater, and working on weekends and house calls and emergency calls and things like that got to be greater. So I began to look for opportunities that would give me some relief from that.
So, you got burned out?
Yeah, that's about it.
Mm-hmm.
Yeah.
You were burned out, but how did you know it was a time, or were you already developing these relationships with your partners to form something new?
Well, it sort of gradually happened. I didn't go out and look for some new opportunities, but they just happened. I was working for the medical school, and we decided we didn't decide, but we in partnership with the Queen's Medical Center changed the Queen Emma Clinic, which had been a clinic for years and years and years that took care of indigent patients. And it looked like we could involve medical students and medical residents and surgical residents and orthopedic residents in that practice, give them practice opportunities, and at the same time improve the care that those indigent patients were getting. And so I worked as a consultant for the Queen's Medical Center and directed the Queen Emma Clinic for several years, and that gave me an opportunity to leave practice and work full-time for the university and the Queen's Medical Center.
So what was the most important things that you learned from your private practice that you're using to lead UHA?
Well, I think I learned primarily that it was very, very difficult focusing on individual patients to make sure that all of my patients had the certain things done. If that makes any sense to you, to make sure they all had their immunizations, to make sure they all had their blood pressures controlled, and so there becomes a necessity to measure whether or not you're actually fulfilling everybody's requirements when you're seeing individual patients on a regular basis, especially if you're seeing 20, 25 a day or 30.
Thanks for tuning in. Stay tuned for more on Greater Good Radio.